Alright, so for the next complications that might actually come up in pregnancies, which we are going to discuss, this is what is known as a pelvic floor dysfunction. Pelvic floor dysfunction. So for this pelvic floor dysfunction, you just have to do it here. The pelvic floor is kind of like falling in. You understand? The pelvic floor is kind of like falling in. You get? So for this pelvic floor dysfunction, it just refers to what a group of conditions affects the muscles, the ligaments, the tissues that support pelvic organs, including bladder, uterus, and rectum. Okay, sorry, I'm just trying to get something. So types of pelvic floor dysfunction. It could be what? Urinary incontinence, right? So the person can be having issues of not being able to control his urine and all of that. You understand? Fecal incontinence. Sometimes it's feces that the person is not able to control. All right. All right. Then sometimes it's pelvic organs prolapse. So for the pelvic organ, all right, this is a prototype. The pelvic organs are kind of like falling. Okay. The chronic pelvic pain. All right. So there's pain in the pelvic region, accompanied by symptoms like urinary frequency, bowel problems, and all of that. So causes of pelvic floor dysfunction. Sometimes these issues or complications are coming in because of what? Childbirth. Sometimes it's aging. The person is becoming very old. Sometimes it's complications of surgery. All right. Chronic constipations. Then neurological disorders. Right. So sometimes conditions like what? Parkinson's disease or multiple sclerosis. All can actually affect the nerves that control pelvic floor muscles. All right. So symptoms is what? Urinary issues. The person is having urinary issues. The person is having bowel issues. All right. Pelvic pelvic floor dysfunction. That's a pelvic pain, right? Discomfort and all of that. Then sexual discomfort. Okay. So treatments, they could actually want to do physical therapy there, behavioral modification, then medicines. Okay, they can also use medicines and all of that. Then surgical options where they are trying to like repair any organ that is fallen and all. Okay, so this is just it for pelvic floor dysfunctions.